Joining me now, Dr. Anish Bajaj and Dr. Keri Peterson. Guys, thanks so much for coming in.
Great to be here.
All right, well, a lot of people don't know even the basics about back pain, so we put together a little quiz that you guys are going to help me with. So let's get to the first question. I want to start right off the top. They're true or false, so they're pretty easy, okay? True or false, the best position for sleeping is on your back. Keri, what do you say?
Steve, this is false. And the reason is that when you lie on your back, it is forcing your spine into an unnatural position. It changes the curvature of the back, so it puts pressure on the joints, the muscles, and the nerves. You're better off sleeping on your side in the fetal position with a pillow between your leg.
I like the back position. I sleep on my back, but I do put a pillow underneath my knees, so maybe that's helping me. What do you think, Dr. Bajaj? Bad move?
I actually couldn't agree more. You know, you want to get on your side, and I caution against not putting enough support between the knees and not letting your head or shoulders roll too much to your stomach. That's a danger position.
All right, perfect. Well, I'm a three-pillow guy. If I shift, I move the pillows. All right, next question number 2, true or false? Is being overweight the most significant risk factor for back pain? True or false, Dr. Bajaj?
For multiple reasons, absolutely. Not only is there additional pressure on the injured joints and the area of source for the pain, but the lack of physical fitness that goes with being overweight means that the primary support muscles for the lower back, especially coming from the legs and the abdomen, are not going to generate that kind of support due to lack of fitness.
I've seen this in practice too. I'm sure you've seen it in your practice, Dr. Keri, right?
I have. I mean, the most common problems you see from patients being overweight, you see arthritis, you see disc herniation, and you can get something called spondylolisthesis, which is a slippage of the vertebra over the other vertebrae.
Right, and interesting, when people lose the weight, in many cases, the back pain goes away. So there you go. So it's definitely a cause. All right, question number 3, true or false? The best way to help a backache is to get several days of bed rest. Dr. Keri.
This is false. You don't want to have bed rest for more than 1 to 2 days, because anything beyond that is going to, first off, worsen your backache, and secondly, it's going to put, your muscles are going to get weaker, your joints get stiffer, and you're worse off in the long run. After about 2 days, you really want to get your body moving. Even if you're in pain, just go gradually.
Right. I assume you agree?
I do, Steve. In chiropractic care, we want to move the bones as early as possible, but assisted. Right. And an individual with back pain should restrict their activity, but not get lured into the rest. It's only likely to delay the healing process.
All right, there you go. So the old days of laying in bed for a week, no good. All right, guys, thanks so much for coming in. Some great information.